I have a lot of patients with sleep apnea that come to see me and they say, Dr. Scalia, I have to use a CPAP machine every night. In some of these cases, with proper analysis and proper treatment, we can actually remove the CPAP after our treatment.
Is this the same for braces and Invisalign? Is it the same length for straight teeth?
Generally, it's the same length. And to be honest, the experience is really different. So
Yeah.
we ask people. Some adults prefer braces because they won't have to take it and remove something. And it really depends on a person-by-person basis.
This is Skin Talks, the podcast where we go deeper than skin, products, and trends and explore the conversations that actually matter in health, beauty, wellness, and confidence.
We're a mother-daughter duo and the founders of Boutique Skin Envie. After years inside the industry, we've learned that health is never just about what you use. It's about everything you digest, how you think, how you live, what you eat, how you move, what you put on your skin, and how you feel in your own body.
If you're looking for insight, honesty, and a fresh perspective on the future of health, beauty, and wellness, you're in the right place.
Let's get into it.
Skin Talks podcast by Boutique Skin Envie, hosted by Beate and Natascha.
Most people believe orthodontics is just about straightening teeth, a nicer smile, more confidence, better photos. But what if that goes much deeper than that? What if the positioning of your teeth and jaw impacts how you breathe, how you sleep, how your face develops, and even how you feel in your body? Today, we're discussing orthodontics beyond appearance, what truly happens when teeth shift, and why fixing your bite could be about more than just your smile. Welcome to Skin Talks, Dr. Scalia. So welcome to the episode, Dr. Scalia. If you guys recognize the name, actually, we had Dr. Scalia's brother, who is my partner, on a while back, who's also known as Dr. Scalia, but that's Joey. And the difference is that Joey is a dentist and Dr. Scalia is an orthodontist. But before we get started in today's episode of all about orthodontics, Dr. Scalia, can you please give us a little brief into how you got into this industry? Was it something that you've always wanted to do as a little kid? Just give us a little bit of an update for our listeners.
Okay, well, hi, Natascha, and hi, Beata. Thank you for the opportunity to being on Skin Talks today. It's a wonderful opportunity. It's actually, as an orthodontist, unless you set aside time for this in your busy schedule, it's nice to just sit back and be able to just inform people about what we do as orthodontists and how we can impact people's teeth and people's lives. So basically, I'm 40 years old and I've been a dentist for 14 years. And I graduated from McGill University as a dentist. And then I subsequently wanted to specialize to be able to understand and treat the most complex of tooth problems and the most complex jaw relation problems, because there's two aspects to a smile, which we don't think about every day. There's the aesthetic aspects to a smile and what people see. There's also the functional aspect to a smile and how people bite together. And those are impacted by two different worlds. There's the world of the teeth and the position of the teeth in our faces. And there's also the position of our jaws. And those are both related. And actually, the position of our teeth can take us as limits because the position of our jaws dictate where we bring the teeth. So as an orthodontist, we can change faces and move jaws, which thereby later lead us to moving teeth. So to me, it's been an amazing journey in going from a tooth to a face to impacting people's minds and how people look at our smile and how our smile impacts us.
That's very interesting.
Yeah, and I think it's a big deal, much bigger deal than many of us even understand. When you see somebody's face, if they have a bad bite or like a jawline that is not aligned to their face, it changes the way they look completely.
Well, I saw actually recently on TikTok a woman who had like some teeth that were over on top of each other. And in order for her to get straight teeth, she had to do a surgery within her palate to expand her palate. And then she got braces and then she got straight teeth. So it's very complex.
It's very complex. And it happens on a weekly basis that we have young adult patients sometimes elderly patients, and they come to see me for an evaluation. And what we're looking at the evaluation is the final tooth position. But what I allow every patient to understand is that tooth position depends on where our jaws are placed with
Hmm.
respective to our face.
Yeah.
So, why I wanted to become an orthodontist was to understand facial proportions, positioning of the jaw, size of the jaw, and how that impacts the lip and the smile.
Interesting. So it's
Ooh.
much deeper than just
It's much
than just
deeper than just
than just the
straightening teeth.
aesthetic. Yeah.
Yeah. And that's what I love, and how I can impact the smile line, the width of someone's smile, and thereby affecting their overall self esteem by moving teeth.
I want to know, in your practice, are you seeing mostly younger people, younger patients because they're getting braces, or do you see also a lot of,
More
let's say,
mature.
adults or more mature people coming in and wanting to really fix their smile and go a little bit deeper than just the aesthetic?
I have a very diversified practice because I was a resident at the Montreal Children's Hospital. So for a year, I had high volume and very specialized training with the pediatric population. And what I learned from the pediatric population was we can change a smile for the rest of our lives
Mm-hmm.
when we treat certain conditions young. And you saw on TikTok that there was someone who didn't have enough space and we widened their palate. Well, that is real. What you saw that we had to make space is something we can do without surgery in a child, in a growing child, in a pre-pubertal child, teenager. We can create space in further teeth. It's something we cannot do as a young adult, because as a young adult, when the facial bones start to mature, and the bone develops into more mature bone, we can't expand the facial bones without surgery. So the types of treatment we do as children is really life changing long term in a much less invasive
Yeah.
manner.
Yeah.
So,
So I have a
what
huge, I have
what
a huge.
age? Sorry, Johnny, Dr. Scalia. Sorry. I wanted to ask you, like, at what age do you start to look at stuff like this?
So the American Academy of Pediatric Dentistry and the American Academy of Orthodontics, we recommend the initial consultation for a child at about 7, 8 years old. That's coincident with the age that generally the first adult tooth will be in the mouth, and we can start to get an initial perspective as to the positioning of their jaws, the positioning of their teeth in those jaws, and then set up a plan. For a child at 7, 8 years old, we don't necessarily begin treatment, but we evaluate. And if the child has a problem that we can correct at that age, we can correct it. And then if the child does not need treatment at 7, 8 years old, we reevaluate the child's tooth development, growth of the jaws at about every 6 to 12 months. So once or twice a year, children come in and we assess whether eruption of their teeth and growth of their jaws is following the pattern that it should follow with respect to the size of their teeth. So to answer your question, we see children usually between the ages of 7 and 8 years old for the first evaluation, where we can already assess if they have problems with their bite or if they have problems with the size of their jaws.
Okay. And so when this patient comes to see you, I'm assuming the mom and dad brings the child. Is it because the mom and dad see the bite as maybe an issue or see crooked teeth? Or is this from a recommendation from a dentist? Like they go to the dentist and now the dentist is like, oh, like I'm seeing something. Maybe you need to go see an orthodontist. Where does that come from?
Generally, it's 50-50. So a
Okay.
lot of our patients will find us on social media, or they'll speak to a friend that we treated, and they'll look at their child and they'll want their child evaluated because they want to assess if their child is missing space for the adult teeth.
Okay. Here. Yeah.
Okay, so 50% of the time, the dentist will recommend to a parent, please see an orthodontist for evaluation, or parents will come out of their own goodwill to evaluate their child's dentition and facial proportions.
Makes sense. Makes sense. Yeah.
And I'm assuming sometimes things like, thumb suckers or people that use susies and stuff, like the parents will see that the teeth are sticking out a little bit more in the front, like more what we used to refer to as a buck tooth kind of thing.
A
I don't
buck
know.
tooth,
I don't know if it's
exactly.
still that, but there's also like
Yeah.
overbites and underbites too. That's a big thing too, right? So
That's a huge thing. And usually by 7, 8 years old, we can start to get an initial idea as to where their teeth fit together. And if they have one of those problems, like you mentioned, like buck teeth or teeth that are too far forward, teeth that are too far back. So there's a variety of issues that we can start evaluating and recognizing as early as 7, 8 years old. Some of those issues will intervene with, and some of those issues will sort of
monitor.
watchful monitor, exactly,
Yeah.
and treat later in the teenage years.
So by doing this type of analysis, starting very young, I would assume that you can prevent a lot of additional costs as an adult if you do it starting very young.
Exactly. Certain problems we can treat as early as 6, 7, and 8 years old, predominantly bite problems. Tashi mentioned before that the upper jaw is too small. That can cause the following issue. So when someone smiles and they bite down and their upper jaw is too small, generally they're also missing space for their adult teeth, but also they have a bite issue. And as they grow, they can grow asymmetrically to one side because of this bite issue. So by treating some of these problems when we're young, as early as 6, 7, 8, 9 years old, we can correct their jaw problems and allow the child to have a more symmetrical growth.
Yeah, we don't think about those things. Yeah.
And that's what I'm hoping that your population of listeners understand, that as an orthodontist, we don't only straighten teeth, we also look at how the teeth impact the facial proportions and the bite, because that bite can also lead, the correction of a problem with your bite can also lead to overall corrections of your gum problems, for instance.
Oh, really,
Or
eh?
hygiene or crooked teeth. Yeah. Because one thing I noticed is that crooked teeth, it's more difficult to floss. And if it's more difficult to floss, it's more difficult to get food out of your teeth. And that can lead to other problems like gum problems or cavities.
Okay, that makes sense.
Yeah, that
makes perfect sense.
And I want to know if, like, let's say somebody doesn't correct their jaw or doesn't get, like, later on in life, they didn't know it was an issue and then they didn't get the surgery. Like, are there any other hidden issues that could cause, like, maybe like breathing or anything that just would say like a consequence of not doing the treatment?
Mm-hmm. One of the you mentioned breathing. That's brilliant. We can improve someone's breathing and ability to breathe from the nose because the upper jaw, what we call the palate, so our upper jaw is directly continuous with the nose. So when we breathe from our nose and we have a wider jaw, we can actually get more air in through the nose. I have a lot of patients with sleep apnea that come to see me, and they say, Dr. Scalia, I have to use a CPAP machine every night. What can you recommend for me? Well, in some of these cases, with proper analysis and proper treatment, we can actually remove the CPAP after our treatment because they're actually breathing much better after the treatment
Interesting.
through both their nose and their mouth because we increase the airway.
Well, that makes sense. I was going to ask you that. I was going to ask you like snoring, sleep apnea, all of these things that we've more and more suffering from today. Can it improve? So that's interesting.
Very interesting. Yeah.
Yeah, we're trying to get more air through our nose and reduce snoring too, in some of our treatments.
Okay, that's interesting. It's good to know.
Yeah, I'm gonna let Joey know. No, I'm pretty sure I've mentioned on a couple other episodes that my partner definitely is a snorer, and he knows that I've mentioned it, so this is not like behind his back. But yeah, no,
He might have to come see you, Dr. Scalia.
That would be great.
I want to know, like, what are some of the, let's say, worst cases that you've experienced in terms of like fixing a mouth?
So some of the cases I think about in my 15-year career are some of the patients that, that at the end of their treatment, they gave me a hug and they said, "You changed my life." And they were tearing
Yeah.
because when we look in the mirror and we're not happy with our smile or our lip line or the position of our jaws, it can impact many aspects of our life, from the way we perceive ourselves, being self-esteem and confidence, or the way we bite and the way we chew together. And the most amazing cases are when the patient at the end of the treatment gets up and says, "Thank you," because that's the impact that we have when we move teeth and when we move jaws. When we change that, um, it can really impact someone's life for the better. And that's why I became an orthodontist, because
Yeah.
we
Yeah.
see results. When you go to the dentist, you get a filling, or the dentist tells you need a root canal. You say, "Okay." But as an orthodontist, when I move your teeth or I move your jaws, not taking anything away from dentists, and they're extremely important in oral health. But when we move teeth and move jaws, there's a whole other dimension of perceived self-esteem.
Yeah, that is interesting. I wanted to ask you, do you do any kind of surgeries in as an orthodontist, or is it more about like spacers and braces and Invisalign and stuff like that?
That's an incredible question, Beata. As an orthodontist, first step is we consult an orthodontist to assess if the jaw's a problem. If the jaw's a problem, then I refer to a specialist colleague, an oral maxillofacial surgeon. And as a
Yes.
surgeon and an orthodontist, we're a team, and our team evaluates together whether the person needs a surgery or not.
Okay.
Some problems require the position of the person's jaw to be changed. And if we need to change a person's jaw position through surgery, then we work with specialist maxillofacial maxillofacial surgeons, sorry.
Okay, so I would assume also you must do a lot when it comes to any kind of accidents, whether it be sports or let's say car accidents and stuff like that, where people break their
Mhm.
jaws. So
Yeah.
realigning the jaw, and then also as a result, the healing process for the teeth and the jaw to be able to be in their natural or like most effective position.
Absolutely. When someone has a trauma and there's tooth displacement, we follow a protocol, and changing position of the teeth with following a potential trauma is a very specialized part of dentistry as well.
Okay.
Which
So
I assume can be very like a beautiful
delicate.
process, but
Yeah,
also
and
like by the end of
delicate.
it, a very beautiful process.
Yeah, and you have to work in combination. You have to work with the necessary specialist for that end goal.
Yeah, definitely. I had a question, but now I'm blanking, and
No, I just
that
find
drives
it
me
very
crazy.
interesting because it seems like the whole industry has really become more specialized, and everybody has their specialty, but each work together, like the
Yeah.
dentist with the orthodontist with the surgeons. Everybody works
Mhm.
together to be able to have the optimal outcome.
Yeah.
It's great.
And straightening teeth as an orthodontist, we my goal personally is to not replace a dental problem with a financial problem.
Yeah.
And oftentimes we finance the treatments interest free to allow people to obtain the smile of their dreams.
I'd like to talk about Cetaphil, dermatologist recommended skincare. At BSC, we believe in professional and medical grade skincare, but we also know that healthy skin starts with the basics. And that's why we chose to carry Cetaphil. It's a dermatologist tested, barrier safe, and perfect for anyone beginning their skincare journey, and perfect for anyone beginning their skin health journey. Whether you're simplifying, resetting, or caring for sensitive skin, Cetaphil helps build the foundation before introducing actives or advanced treatments. It's where good skincare starts. Shop Cetaphil at bskinenvie.ca. That's BSKINENVIE.ca. And use Skin Talks 15 for 15% off your first order.
So my question is one, why is it expensive to get braces or Invisalign? Because I know that there's
Mhm.
like some crazy technologies behind it. Um, and also, why is it not a part of like regular insurance? Let's say like you go to the dentist and you have insurance, like it's covered, right?
Well, at
Why
least
is orth?
Uh-huh.
twice a year or every 9 months. Yeah,
Yeah.
usually most of the
So why
plans.
is orthodontist not under that same umbrella? Is it because it's more? It could be perceived.
Aesthetic. They're
Yeah.
seeing it as aesthetic.
Yeah, I think so, Beata. I think they see it as aesthetic, and depending on the person's individual, depending on their insurance coverage, some people are covered for
Okay.
orthodontics up to a maximum of a certain amount, and some people are not, depending on their specific coverage. So it's really important that when people come and see me, I give them a form that I sign that they check with their insurance company if they're
Okay.
covered for orthodontic treatment. It's sort of like an extra in
Yeah.
their insurance plan. If they're covered for orthodontics, then they may not even know it, and they have a certain amount that's available for an orthodontic treatment.
Okay. And then the cost. Why is it so expensive?
Yeah, that's a good one. I think part of it has to do with the material cost. Part of it has to do with, and there's different ranges in prices
Yeah. Let's talk
when it
about that
comes to
too.
orthodontic. Let's talk about the range in prices for a second. So, the way I like to explain that to friends and family and patients is it depends on who's piloting the airplane. And and basically, as a specialist, because we had 3 years of additional training as an orthodontist and a master's degree, we're trained how, as specialists, with an exceedingly abundant amount of hours to treat the most complex cases. But
Hmm.
not all these cases are really complex. There are cases that are, you know, simpler in the planning. And as an orthodontist, I try to, in all my offices, we adjust the fees accordingly, according to the length of treatment. And I think that's really important that we evaluate. Every smile is different, and we need to understand that life is not a box, and we have to understand that certain cases take less time, certain cases take more time, and I think that as orthodontists, as a profession, we have to be able to respond to that and adjust our fees accordingly.
Okay. That's good.
Yeah, so it's case by case and often in
It has
certain.
to be
Yeah.
it has to be case by case basis, because if not, then it becomes more cookie cutter in terms of fee structure, and it may allow certain people to not obtain not have the treatment, because the numbers can be quite high for an orthodontic treatment.
Hmm. So in general, when you're straightening people's teeth or doing these types of things, are we looking at like between a 1 year and a 3 year obligation kind of thing?
Yeah,
Most cases.
yeah, most cases, I would assume the average time for an adult would be between, I would say roughly a year and a half is average, which means we have some 9-month cases. We have some cases that are quite more complex, which may hit the 2.5 year mark.
Hmm.
I would say the average ballpark would be about a year and a half for an adult to have perfectly straight teeth, and then retainers at night to keep those teeth straight.
Because they do move, eh? Again, like your teeth will
Yeah,
move, eh?
they always want to go back to their initial natural position. So
Yeah.
It's interesting. And then so is this the same for braces and Invisalign? Is it the same length for straight teeth?
generally it's the same length. And to be honest, the experience is really different. So
Yeah.
we ask people. Some adults prefer braces because they won't have to take in and remove something. Other people, I would say most adults do prefer removable aligners like Invisalign and their competition. And it really depends on a person by person basis.
Yeah.
Are there
It's
any
also
benefits though than doing braces over Invisalign, for example? Or is it a cost factor?
Certain more complex cases are preferably treated with braces because the way we move things around changes with braces. But generally, removable aligners like Invisalign, like Spark, like Angel aligners that your dentist or orthodontist can talk to you about, generally, it's preferable for adults because we can remove them to drink coffee and brush our teeth.
Yeah. Yeah.
Yeah.
And eat when you're eating and stuff like that. Well, Tashi just got them.
I just got mine.
And she's a wonderful, she's a fantastic, a phenomenal patient.
Thanks. Well,
When I
you're
say she's
phenomenal.
early at her appointments, she has a newborn and she's early at every appointment.
I know, eh? That's actually true. Well, I have to leave very early. I come prepared. But yeah, no, I have to say that Invisalign is, it's annoying to take them in and out for sure, but I would much prefer aesthetically to be having Invisalign than braces. I think because of my age, but like I see also a lot of adults wearing braces, and I'm not like, I don't look at them and be like, you have braces. But for me personally, I think that an Invisalign is suitable for my liking. But I have to say, when I left your office, I was like looking at my teeth and I'm like, not comprehending how Invisalign works. And then I spoke to Joey, and he kind of explained it to me, and I was like, wow, it's actually such an interesting, like, how Invisalign works. It's genius, right? Because I wasn't understanding how I was distracted. I had my newborn. Everybody was there. You have a team of people there. And I was just like, how does it actually move my teeth? Because like, it's just like a thing in.
It's like
so what's the technology behind it?
So the process is quite simple for people. We use a 3D scanner. It's sort of like an iPad. We pass an iPad in people's mouth with a little pen. When we 3D scan mouths, and using the 3D scan, I sit at a computer for about a month and I move every single tooth on a 3D software. And once I'm happy with the position of the teeth, I create the smile on a 3D software. Then we print 3D printed individual clear aligners, these removable Invisaligns, retainers, and they move the teeth on a week by week basis.
Insane.
So how it works is basically people change the removable retainer once a week. We used to change once every 2 weeks, and now we change every 7 days. And each week progressively there's a certain amount of movement programmed in the retainer. And the retainer is going to move your teeth up to the position that I set in the 3D planning software.
It's genius. It's
So
cool.
You change your retainer actually
every 7 days. So on Thursday, I'm putting in a new one.
So it's already planned. You already have it?
Yeah, I have. I think I have 30 sets.
Oh my gosh, I did not know that.
And so like, there's these little bumps. I'm gonna use horrible terminology.
What are they, by the way? What are those things? You cement something in.
The bumps are they're what we call anchorage. So we hold on the tooth. It's like it's for retention. So the aligner, so the retainer can properly move the tooth. We put a composite button shaped in, sometimes it's usually in a half moon, a little half moon on the tooth, so that the retainer can grip properly on the tooth. And that's in clear composite.
Yeah, so you don't see it. Anyway, so the technology behind it is absolutely insane.
I always thought it was just one thing that you stuck in your mouth. I didn't realize you had to change it every 2 weeks, but it makes sense because you're moving.
Yeah.
You're moving.
I have a question about is it possible that you're potentially moving a tooth too fast? And is there any side effects that could happen if you move a tooth too fast?
That's an incredible question, Tasha. You may be dating a dentist. So if we move teeth too quickly, sometimes actually tooth movement can be hindered or delayed because the tooth is not ready to react. So there's always that sweet zone when we move teeth that's why some treatments take 1.5 years, because we can't go too quickly. The tooth can only move a certain amount per day. So 2 things happen if we try to move teeth too quickly. 1, it won't work. We won't get the desired movements we want. And number 2, the person can feel pain.
Yeah.
So if I push too hard on your teeth, it's going to hurt. Or if I push too hard on your teeth, they're just not going to move in the right direction.
Okay. That's like it's
the pain is what I remember.
It's the sweet spot, you know?
Yeah. No, so
did you experience pain? You've had yours for just over a week?
No, Thursday will be a week. So I would say the first 48 hours are when I feel the most, like, let's say I want to say pressure, like
a little
where I just
uncomfortable.
Yeah, it's
You
not
said you felt
even.
claustrophobic a
I
bit.
felt a little bit claustrophobic and a tiny bit irritated.
A tiny
Yeah.
My
I think a
my
little bit
dentist
more than
my
did.
dentist boyfriend can agree to that I was getting snappy because I was like, something's bothering me in my mouth. That being said, like, I don't feel pain, and I guess some of my teeth have maybe moved a little bit, so the pressure has subsided and I don't feel any more pressure in my mouth, or maybe I'm just used to it. I'm not sure. But
Mhm.
it's definitely different from like the first 2 days, 2 to 3 days. So
Mhm.
I have no complaints about it. I don't feel pain. I'm like, I'm
You're
chilling.
loving it, eh?
Yeah.
I
I'm
know
so
I
she
think
excited.
she
wanted
wanted
straight
those.
teeth, Beata.
Yeah, if she did, and I'll be honest with you. When I was raised her alone, and she wanted to have Invisalign very, very young.
No, braces, yeah.
Whatever you wanted to, and it's just not something that was in any way in my budget at all as a single
Yeah.
mom. No, and I kept hoping that when her other teeth came in, because that was also, what I was told, they're going to straighten themselves out. Like you're going to be fine. It's all going to happen. It's all going to work. But I
Lies.
had my teeth replaced. No, but I didn't know. I really did think that.
No, it's okay.
But I had my teeth fixed too, because I had big spaces in the same area that you have your spaces there where you're turning. I had that, and they filled them in with tooth
Oh yeah.
because I had my teeth redone.
Oh,
But
really?
yeah. But before that, they just put like caps on and filled this space out. So no, I'm very excited for you. And I just thought, your life was just waiting for dentists to come into your life. So like, here we go.
Right?
I was manifesting for you. Come on.
Yeah. No, I'm very, very blessed. My children will be blessed with good
Yeah.
teeth. I'm very lucky.
I wanted to know, is it ever too late to fix your bite? Like, is there a stage of your life that you can't anymore? Or is it at any time just more complicated, maybe with age?
That's a great question. We have patients in their 70s. We have
Okay.
patients that waited their whole lives to straighten their teeth, and timing just could never fit their schedules. So I recommend anyone that wants straight teeth should ask their dentist and assess whether that's possible. The only cases that we won't start really are people that have problems with their teeth or their gums. So for instance, people that have gum disease, or
Yeah.
people that don't have the structure or the tooth structure that could move the teeth. So I think it's important to have the general dentist make sure that the teeth are in good health. And then at that point, we can move teeth at any age.
That's
Okay.
amazing. That's beautiful.
Yeah, I never forget. I had a patient in her 80s, and she had this one little front tooth, Judy, that bothered her, and we actually started Invisalign treatment on her, and she was very happy.
That's so cute. I love
Yeah.
that. Wow.
I mean,
It's self-confidence,
it
right?
is. It
It's how
ultimately is.
you want to feel, when you smile. It's a really big deal.
Yeah, I think anything when it comes to your smile is definitely like for a lot of people, it's the first thing that you see when somebody smiles,
It's the
right?
first
So
thing we see.
yeah, it's when you're not confident with your smile, like that could be perceived like somebody can say, oh, they're not very confident, or like you hide the way that you smile, you don't show your teeth. So like there's a lot of factors to it.
I wanted to ask Dr. Scalia, are there anything that people should be concerned about in terms of being sold any kind of shortcut, or anything that people should be aware of when choosing an orthodontist or like procedures?
I would advise when it comes to moving teeth that patients speak to their dentist, but they should also do their own research and understand that teeth take time to move, and it's okay to promise certain time, like say we're going to finish in 6 months, but ask, okay, what are we going to get in 6 months as a result? Because as an orthodontist, we also have very short treatments, but maybe our end goal and what we're trying to get as a result is different. So I think it's important for the person to do their research and to feel comfortable with the plan, and then ask all the necessary questions so that there are no surprises.
Yeah.
When people come to me and they're not happy with their treatment, it's generally a problem with communication with the practitioner. So I think it's important for everyone just to ask questions, feel comfortable. Feel comfortable before you start your journey, because it's an important journey, and it's in a journey that's going to affect many aspects of your life, from chewing to self-esteem to the smile and the aesthetics of your straight smile.
Yeah, I love it. I love
Yeah.
it. And then so for everyone listening, as we mentioned that I got my Invisalign done with Dr. Scalia, you have an office in Westmount on Sherbrooke
I have an office
and
in West Montreal,
and
and
then
I have
two
two
other.
offices in the north.
Yeah.
Yeah, I have two offices in the North Shore, in Terrebonne and in Blainville, which are suburbs about 30, 40 kilometers north of Montreal.
And I have to say, from my experience, was such a beautiful experience. Not only is your team like outstanding and just so like welcoming and warm, but your office itself is so beautiful. The aesthetic, I'm like, I could go there all the time. Like, I'm all about aesthetic, right? I love it. And I walked in and I was like, okay, Dr. Scalia knows what he's doing here. It's so beautiful. Like, it's
Yeah.
stunning. Like, I'm speaking on
Thank
behalf
you.
of the
Thank
Westmount,
you.
obviously. I'm assuming they kind of all look similar, but yeah, it's nice to go
I
into.
really,
It's when you grow up and go to dentist's office, a lot of them are like
They're kind
really
of
old and
yeah.
run down and like not that nice and like kind of scary. And I've never been to an orthodontics dentist like office before, so I'm assuming they're kind of the same. Yours is very different. It's very, very beautiful. I loved it.
thank you so much. I wanted to create an environment that felt comfortable,
Yeah.
a happy environment, because sometimes at first it can be stressful, to go to a
It's
new place and talk
intimidating.
about your straight. Yeah, it's
Yeah.
intimidating. So I wanted to create a pleasant environment that could connect with people.
Yeah. Well, you succeeded at that.
And also, you're in the aesthetic industry, right? You are, I mean, it is
Absolutely.
functionality. We talked about that, but there's also aesthetic component. If you walk into an office that's offering you aesthetic, that isn't aesthetic,
Yeah.
it's kind of like goes against
Yeah.
the vibe. Like,
It's counterintuitive.
yeah, absolutely.
We finish every episode. This has been amazing, by the way.
Yeah, thank you.
Not surprising. We finish
You're
every
amazing.
Thank you. We finish every episode with sort of like some 3 rapid questions. So whatever comes to your mind first, just answer it.
It's a test.
It's like a little, yeah. What is the one thing people should understand about their teeth and health that they don't?
Straightening teeth may not be expensive as you think,
Yeah.
Oh,
or
good.
take as or may not be expensive as you think, and it may not take as long as you think. Just ask the necessary questions and get multiple opinions if necessary.
Love it.
I
love
love
it.
that.
Love it. Love
I
it.
love that. And you said before you offer financing, which is fun for people to know
Yeah,
as well.
that's
So
very
it's like
important.
makes it more digestible. The second question we have for you, Dr. Scalia, is what is one mistake people make when it comes to their oral health?
They don't floss.
Love that. It's so true too. And I can tell when people don't floss, just an FYI.
Yeah, you're like kind
I'm
of
like,
yeah.
I'm a little obsessed about that.
If someone could only do one thing to improve their oral health, what would it be? I
Might
feel
be
like-
the same question, but you have to answer it differently.
Don't brush that hard. You don't have to brush very hard. Brush softly.
Yeah. Is it true you should brush in circular movements too, not necessarily back and forth?
Brush in circular movements and brush softly. You'd be surprised as to actually what it takes to remove the plaque around the teeth. Doesn't actually take quite much force, but just consistency
Yeah.
and repetitive motions.
I love that, but I do have one more question for you on that subject. Do you recommend a toothbrush or the electrical brush? Like, what is the better thing to use?
That's an amazing question. I get asked this question about 35 times a day. And my answer is whatever works for you. If you're able to get that toothbrush in the back of your mouth and brush properly in circular soft motions, I think a manual toothbrush is plenty. If for instance you're rushed and you're distracted and you can't think about getting that toothbrush to the back of your mouth, if an electric toothbrush is going to make it easier to get to the back of your mouth, then go with an electric toothbrush.
Okay.
Okay. I love that.
All right.
Thank you so
this
much for today.
was great.
That was amazing.
Thank you for your time. We
Thank you
appreciate
so
it.
much for this opportunity to be on Skin Talks. This is awesome. Thank you so
You're
much.
the best. Thank you.
This is so cool. Thank you.
Thank you for listening to Skin Talks.
If this episode inspired you, taught you something new, or just made you feel seen, please share with someone you love. And if you believe in thoughtful and empowering conversations that help you make better choices for yourself around your beauty and wellness, please rate and review the show. It helps us to grow our community, and we deeply appreciate it. Because this isn't just about skin.
It's about claiming your beauty, feeling strong, informed, and at home in yourself.
See you next week.